How HIV treatment works. HIV treatment is another name for medication. There are many types of HIV medication called antiretrovirals, which work in different ways and combinations. The aim of treatment is to make it harder for HIV to copy itself and spread to other cells. The goal of it is to reduce the amount of HIV in the blood so that it cannot be detected by tests. When should you start your HIV treatment? Not everyone needs to take treatment. Your doctor will help you decide when the best time to start is. People generally start treatment when their CD4 count is low. This is the number of CD4 cells per cubic milliliter of blood, which in the UK means below 350. Sometimes doctors may start treatment before if there is additional risk, such as during pregnancy. How does the medication work? HIV treatment involves taking anti-HIV drugs every day. The best way to make sure treatment works is through adherence. Adherence means following the doctor's plan exactly for how you are supposed to take your medication. A combination of drugs prevent HIV from copying as quickly. By slowing down HIV, the body has more time to make CD4 cells to help fight off infection and keep the immune system strong. All anti-HIV drugs try to prevent HIV from copying itself. The different types of drugs do this in 4 different ways. 1. Stop HIV from entering CD4 cell. These are called entry inhibitors. 2. Stop HIV from changing its structure when it prepares to copy. These are called nukes or non-nukes. 3. Stop HIV that is already in the CD4 cell from getting to the place in the cell where it can copy. These are called integrase inhibitors. 4. Stop HIV from copying. These are called protease inhibitors. What about medication for children? HIV treatment works in the same basic way for children, but since children's and young people's bodies are still growing, there are not as many different types of medication available. Whatever age you are, it is really important to take HIV medication at the same time each day, because the medication only works for a certain length of time. If you take it late, there is a risk it will not be as effective. If you miss a lot of doses, your body can build up resistance to the treatment, and you may not be able to take that combination anymore. There are only a certain number of combinations available to take, so it's important to avoid resistance. If there is something making adherence difficult, it's good to talk this through with someone, maybe a friend, family, or your doctor. Although there is still no cure for HIV, with good adherence and many different antiretroviral drugs, it means that people with HIV are living long and healthy lives. For more information on HIV, please take a look at our online library.